Thank you, Madam President. I rise in support of this bill and ask members to do the same. I want to start off by thanking not only Senator Lori and the conferees, but everyone who had some input into this bill, especially the staff who's worked tirelessly to get this to us in a very, very short time frame. We just met until 5, until 5, I think 5:30 in the morning, and we have a bill in less than 24 hours right back to us for consideration in front of you. So that takes a lot of time, and I want to take a moment to really thank the Revisor's Office and everyone who worked so hard to get this to where it is today. And I do have a lot of areas in this bill that I support and I'm very proud of, and it is tough work when you have to prioritize all the needs in this area, and to single it out or to simplify the work in HHS to MNsure, I think it's a disservice to the work that's done in HHS on a daily basis. So I invite anybody who is interested to stop by the committee and be part of the discussion, because it is a very, very detailed oriented, and a lot of minutia and a lot of details do matter. And in this bill in particular, I was very, very proud with the Senate version and their Senate coming in with a strong bill, which to Senator Sharon's comments was really focused on investing in programs that had a great return on investment for taxpayers, and really trying to bend that cost curve for our increasing cost of health care that we all know about. And MNsure's not going to fix it. There's so many other components in Health and Human Services, housing, mental health, rate reimbursements. There are so many different moving pieces and different areas that we need to address, that to single something out as just MNsure's going to fix the problem, I think it's really not understanding the difference, the changes and the challenges, and the lack of understanding of how complex the Health and Human Services budget area really is. I do want to mention a few areas that I supported and authored that I am grateful they are included in this bill, including the 2% rate increase for chemical dependency that Senator Sharon mentioned as well. It's been more than 20 years where we haven't seen an increase there, and this really is treatment of services to maintain and increase access to high quality, cost-effective care that is tied to reducing ER visits, hospital stays, and incarceration. So this is one of those tools that we have in our toolbox to really try to bend that curve. So I'm proud that that's included in this bill. Another area is the Gillette Children's Hospital rate increase from 44 cents on the dollar to 62 cents to treat kids with disability and complex medical conditions. This facility in our state, we're very lucky to have. It's world-renowned, and a lot of our MA patients are using this facility, and we certainly have to support the reimbursement rates to take care of our most vulnerable kids in our state. The fetal alcohol spectrum disorder funding as well, I'm addressing 100% preventable disability, and reduce prenatal alcohol exposure. That's another area that we don't talk about, that it's almost not even addressed in our school system, but it's 100% preventable, and this bill does move in that direction to really work with those mothers and make sure that we have newborns that are toxic free. So I'm very proud that we have some funding to expand that system in that particular area across our state. Another area is evidence-based targeted family home visiting, which serves first-time low-income pregnant women starting early in pregnancy and through the child's second birthday. So we know that this is an evidence-based area where we can also make a very big headway in trying to cost contain and to target and prevent later costs in the system if we are addressing them early with families. So great to have that there too. Another area that we funded in this bill is the Poison Control Center, which a lot of us, I'm sure in this chamber, probably have had some access to that particular service for our state. It's actually housed in the HCMC hospital, and they provide the service from that hospital to the entire state, really trying to answer all the requests from all of our counties. All 87 counties are served by this statewide program, answering 48,446 calls a year. And lastly, the stroke system, a system that we're trying to also set into place throughout the state, and it's a network of ambulance services and acute care hospitals in Minnesota, meeting the national standards of treatment of acute stroke patients. We're also expanding that throughout the state with this bill, and we're trying to get access to make sure that our citizens and our constituents who suffer from stroke have the access to the best care in a very short time frame, and again, saving costs in the long run because we're able to treat them earlier. And other bills that I strongly support in this bill are the Homeless Youth Act and the reducing the sliding fee waiting list and CCAP. Those two areas, I've received a lot of correspondence from my district, and I know a lot of you have as well, in terms of supporting our youth and supporting our families to be able to afford to go to work and be productive citizens of our society. However, I also have my disappointments in the bill. No bill is perfect. And I stand in disagreement as to some of the shifts and gimmicks that were contained in this bill, and despite fighting them in conference committee, they still made their way through the conference committee process. And in particular, I was disappointed to see that from the beginning we had a cut in our Health and Human Services budget with a negative target, and that was $328 million. And frankly, it was robbing Peter to pay Paul. We actually increased premiums for our working poor in Minnesota Care. Yes, we saved Minnesota Care, but I don't think that was even an honest proposal to begin with, because we know we had no alternative to how to deal with a population that we have a model program in our state, nationally renowned, and we had initially some offers to get rid of it from the get-go, and I think that was also not even a starting point of our negotiations. And we're now asking people in Minnesota Care from 150 to 200% of the poverty level to actually pay more for their health care costs while we have a budget surplus. So I don't know if that's the right policy for our state. I certainly don't agree with it, and I think this bill falls short in that regard. And in terms of shifts and delaying payments, I, along many of my colleagues in this chamber, Madam President, ran against shifts and gimmicks, and now I know that we have some in this bill, and I have to swallow that, and because our counterparts insisted on them, and we started again with bigger shifts and gimmicks, like a $300 million fake savings that was proposed initially in our conference committee, and eliminating again Minnesota Care, which really doesn't solve the cost in healthcare. So let's remember where we started, and with a fake budget, and where we are today. And certainly I have a reservation in that regard for this bill. But the good of this bill and the results for our elderly, our seniors, our mental health population, our children, and our homeless Minnesotans really outweigh the flaws in this bill. And that is why, in the spirit of compromise and in recognition of divided government, I stand here as Vice Chair of the committee to ask for your support. And certainly we're here to answer any questions in a complex area of health and human services. And I'm really proud of the work that we've done in terms of the environment that we're under. So thank you, Madam Chair, and I really urge members to support this bill.